Please, good morning. Please, can we settle down, please? Let's be in the mood of primary health care. Other courses have come and gone if they've come this morning. So this is time for PHC. So for you to be able to follow, the ambience must be that of what? PHC. Think PHC now. If not, we'll be here talking about PHC. We'll be thinking about another thing. All right, we are still on the course Primary Health Care PHC 201. And before we continue from where we stopped in our last class, I want to say one or two things. Please listen carefully. You know, the training here is not just about passing exam. I keep saying that. You are being trained both in what? Character and what? Learning. Character and what? Learning. You must fly with the two wings. You must fly with the what? The two wings. Very important. If one of the wings has issues, you are going nowhere. If you like, graduate with distinction. If you have no character, I keep telling people your certificate may earn you a position, but your character may chase you away or promote you. Your character will do either of these two things. Wonderful, this person, distinction, boom, you apply the person. Fine, you have secured that position. Your character will do either of these two things to you. Is either your character help you to do what? Climb the ladder, or to do what? Pursue you. So please, let's have that at the back of our mind. And secondly, please, you also train here. In fact, tomorrow you don't even know where you see yourself. Tomorrow you may not know where you see yourself tomorrow. There are communities, institutions, very organized that you rarely see anybody to talk to. You rarely see anybody to even speak to. Everything you are doing in that place is in their chosen media of what? Communication. Simple. You rarely see anybody you stop. Yes, sir, please. Nobody will talk to you. So if you don't learn how to, as far as here is concerned, my class is concerned, our only media for communication is your what? That WhatsApp group I created. So if you cannot calm down and go through, I'll force you to do it and learn it. If you cannot calm down and go through the information there, analyze the information there, and be able to know what the intention, where the class is going to. If you cannot do that, I'll help you to do that. So what we are doing now, if you like, keep posting. If you keep post 100 times, I don't even care. Once you don't follow what is there, you keep posting, and you post until 10th what is it called? 10th February. You also be ignored, and you see yourself not completing your CA. I promise you that. Nobody is punishing anybody, but that is what I am paid to do. I have been in the different organizations. You see nobody will talk to you. You are going to talk to the person. Please, he's busy with what he's doing. Nobody is talking to you, because there's a medium for communication, and every day information you need is in that what. But here you see a human being in the group. I posted something. He will say, "Come to your office, sir. Did you say we should do this thing?" I don't understand. It irritates me. It's already in the group. The person saw it in the group. Sir, I saw it in the group. Is it? Are we going to? We're going to do what again? It's already there for you. Go through it and do what? Act accordingly. It's when you follow what is in the group and you have issues. That's when you will now say, "Sir, but so thing was posted. This has been posted." If it's an error, then we do what? Notify it. And that is also happening. See, I keep saying this medical profession is all about following what? Instruction. Take it or leave it. Prescription will come to you. You look at the prescription. You go and start asking, "Doctor, did you say we should give this drug?" Is that what you should be doing? It's only they're looking at you. So when I go to learn all those things, it's now. It's not tomorrow. So whatever you see me doing, I have my reason for that. And if I insist on that, what did you ask yourself? Why this man insists? No, there's something, there's a message this man is passing. Let me cool down and look into it and find out why he insists. Why did he insist? There are some things you come to me to tell me. I'll just cool down, we'll discuss it. There are some things you come, I won't even allow you to finish. I'll tell you to go. What you should ask yourself? That's the reason why he refused to listen to me. Avoid sentiment, be objective, sit down and find out why, and you start seeing that there's a lot to learn. No, we keep learning. Am I communicating? Please let us. We are even talking about WhatsApp. WhatsApp is even so open. The organization you see is email. You don't even know when mail comes in. WhatsApp is that you even know when the information. What if I decide to forget WhatsApp and start dealing with email? What then are you going to do? It's email they communicate to, not even WhatsApp. Some will be notice board. Once you come to that place, you go to notice board and act based on the information you see. Nobody will talk to you. You may even think that they are hostile. No. All of them know where the information is posted. Please let us learn that thing. It's very important. If not, then I have no reason opening that WhatsApp group. I open it so we can communicate if there's important information. Our issue is that I understand is our problem, but we need to change it. We don't like reading. They are this saying, even though I don't want to accept it, but it's actually a fact, but I don't want to accept it. I told myself I will not accept it because it's not a good thing. That if you want to hide something from an African man, put it in what? Black and white. He will not read it. He will not go through it. Lie. And he will start acting accept. When the issue now comes up, you now bring up that thing. He will start saying, but you should have told you what? You have already been what? Told. Please, I beg you, let us learn that. It doesn't stop here. I'm talking about for the future. Alright, so that's all about that. I don't know, where did we stop in our last class? Thank you. Can someone remind us where we stopped in our last class? I think we are through with this course. Hope you know. I think that's the last topic, right? Role of what? Formal segregation in what? I think so. That's the last thing. Yes, that's the last subtopic on this course. That means we are ending this course today. That means we are ending it today. Alright, so today we look at the roles of pharmacy technicians in the care of the aged. Roles of is the same thing, but this one is now personalized to the care of the world. There's nothing else you do for the aged. You're not there to clear poop. You're not there to, unless you apply to work. But you can still help out anyway if the need arises. True of us, yes. Especially, you cannot say because you are not a nurse or a nursing assistant, and you say that the patient is, maybe you went to do one or two things concerning the drug this thing, and none of them is around, and the patient needs to be carried, and you say it doesn't concern me. I've done what concerns me for drug, and you go, it's not what good. Am I complicating? You can say help out in one or two things. So far, it's not a traditional treatment in terms of maybe injection and everything. Every other thing you can just help out and do one or two things there. So if the thing annoy you, you can report those that are supposed to do what, do it, because they can't be collecting salary without what, working. True of us. But for the sake of the patient, you can help out. So one or two things. Maybe if it weren't carrying or shooting, but if there's a hospital you go, all those people, what they call, so some of them are nursing assistant, actually not nursing assistant. Some of them are porters. There are some things you see them. Everybody is oga in their own words level. What they are supposed to do, they will not do it. Maybe a patient need to be carried to so place. See them. If you feel like they will not come, maybe they are related to the owner of the hospital. They are looking at you. Why are you the one to tell me what to do? If you abandon the patient like that, it's not good. True of us. For the sake of the patient, you can help out, because if at the end nobody help the patient, at the end it will tell on the image of the what hospital. You can help out, do one or two things, then you can do proper reports with evidence that this person is not doing its work, and he or she will explain why he or she fails to perform the duty. So the point I'm making is that you have the traditional roles you should play as a pharmacy technician. You do not ignore those ones. I'm not communicating, even though you help out in one or two things. That is not clinical duties. But at the same time, do not neglect your traditional roles. So pharmacy technician play a vital role in the care of the aged, particularly in long-term care facilities. In long-term care facilities, hospitals and community pharmacies, they have responsibilities that have evolved over years, and they perform a wide range of tasks. So this history of pharmacy is very, very interesting. It took time over the years until we get to where we are now, and as the profession evolves, the role of each of us, pharmacist, pharmacy technician, pharmacy assistant, they are all evolving, and everyone finds his or her place in the profession. Now the role is now clearly defined. So what are the roles? Let's start from the medication management. Pharmacy technicians assist with medication management, right from preparation, packaging, and even monitoring medication regimens, and also identify. I don't know if it was in this class that I explained my encounter with a pharmacy technician attached to me when I was in one hospital. The intervention she was able to, she intervened on the health care of a patient, drug-related issues, problem the patient would have passed through. The technician actually helped. That showed that a technician is not a robot that is carrying drug up and down. A technician is not a robot. Am I communicating? So don't make yourself a robot. But you can actually become a robot if you are empty. Sorry, you can actually make yourself a robot if you are empty. How can you because here we talked about identifying potential interactions and duplications. So somebody that doesn't even know anything concerning actions and use of medicine, I don't know, at the end all this group of, please tear this certificate and give me, let me go away. So tell me, how will you now be able to help out, or even to find out potential interaction or any other medication issues that may come up as a result of a particular prescription? It's only those that are well informed. And when are you going to be informed? Is now, it's not tomorrow. It's when? Now. And that's why you are doing your AUM. All those things you'll be doing is to get you informed. So it's not left for you to study, not just about passing exam, but study. You study. But I thank God, I'm happy that the way I design my class, whether you want to study or not, you must do what? Study. Unless you don't want to pass, you must study by fire, by force. And as you are failing, you are seeing it results, you are failing. So nobody is victimizing you. You are doing yourself. So you must study before you pass. So even if anything happened, at least I'm sure that you must study before you do what? Pass. So that tomorrow, if you say that I taught you, I'll be proud wherever I am that I did what? I taught you. Unless you decide to be a dropout, that's where you will not know anything. But if you decide to pass through me, you must study. I'm sorry, I cannot do anything about that. So please, if you are angry today, just try and be happy and try and study. Then all of us will be what? Happy. And your patient will be what? Happy. And you'll be what? Fulfilled. Alright, so sorry. Now, so that's what the formal technician does in terms of medication management. We are assisting from the preparation, dispensing, and the packaging, anything that has to do with what? Medication. From the preparation even down to even, that's why you do your dispensing. You do your dispensing, you do your action, and you use of what? Medicine. You do practice, formal technician practice. All these things will help you to be able to, say one or two things when it comes to what? Patient care with respect to what? Medication management. Are we together? They also help the elderly patient. Now, they help the elderly patient receive their medication. They also help the elderly patient receive their medications correctly. Remember that this patient, remember the graph I drew here some time ago, from the infant early stage, adult stage, and what? Elderly stage. Remember that their drug is not, their medication management is not just anyhow, like that of what? Adult. I'm not communicating. They are special. They are what? Special. So you should be careful about what you give them. Because what you do can actually keep them or take them to what? Early what? Grave. You can cause issues for them. So that's why the formal technician ensure that they receive their medication correctly and on time. Correctly and on what? Time. So this is important in preventing medication errors and adverse what? Reaction. If reaction to an adult can be adverse, now tell me what will happen to them. Their own will be what? Worse. I'm not communicating. Their own will be what? Worse. So you should be very careful about that. Now the next role is patient education and support. Patient education and what? Support. So pharmacy technician, they provide education and support to elderly what? Patients and their what? Caregivers. Yes. Little thing, telling them that this is what you need to do. Please take this drug so to make sure you don't take this drug when at the social time is part of the what? Education. It's not when you now wear suit and come to the board and say no. That little ones you are doing where you work, your first to tell you because of the confidence he has in you. So first will tell you, okay, please, why not just do it? Let me watch you. You are helping out. Am I communicating? You are doing what? Helping out. Of course, before the pharmacist will tell you, do it, let me watch you. He or she knows what is inside you. True of us. If we call one day and be asking, please, for your interaction, he or she now talks about pharmacology of simple drugs you encounter. You're looking at him like this, like as if you don't even pass through the walls of pharmacology of health. You'll be like, he will turn you to robots. You only be carrying cartons from the store to the store, and that's all, and be taking stock. You don't blame the person, and don't be angry that there are people he loves. So no, it's not true. You have placed yourself where you belong, and you'll be doing that, so you'll be happy. You'll be happy, because you wouldn't want to cause issues for the patient. True of us. Because take it or leave it, the ratio of pharmacist technician to pharmacist should actually be pharmacist 1, pharmacist technician 2. But now it's not true. It's not a reality. Am I communicating? That is the recommended this thing. One is to what? 2 pharmacy technicians to 1 what? Pharmacist. But you may come to some places, you may not even see, you may see one word pharmacist there. Then you start seeing pharmacy technicians everywhere. Am I communicating? Maybe they feel they cannot pay. They will just manage. Some, they will turn a pharmacy technician to what? To pharmacist. The person will be faulting himself as a pharmacist. Just to make people make believe that we have a what? For a what? Pharmacist. Am I communicating? Now, you see that, take it or leave it, when you have just one pharmacist and others for pharmacy technician, the traditional roles may not be accomplished of the what? If you may start delegating some to pharmacy technician to do what? Do. Because there you may see others lined up. You may see patients lined up look to take their what? Medication. One pharmacist cannot sit down and he may say, okay, he will look at the finest of the finest he's working with. 2 of us, and the finest is not by your heart or your beauty. Your finest, by finest I mean what is inside you. And when you come, he may ask you. I don't know if you have been with some pharmacists. They will ask you questions. You think they are just looking. No, they are trying to find out who they can do what. Give some responsibilities. When the going becomes what? Tough. They may just be throwing one question. I'm watching you. I'm watching you. When in such situation, he may say, okay, please, can you help? He may watch you do 1 or 2. Of course, it's only somebody that knows. Of course, it's only somebody that knows will be able to know when he doesn't know, and start looking for who to ask when he doesn't what? Know. Mark the words. It's only somebody that knows when he doesn't know, and be able to ask. Someone that doesn't know will always do as if he knows. Then keep making mistakes because he don't even know what to ask. Hello? Yes, it's someone that knows what to do, what to ask. Because the more you know, the more you find out you don't even know, and the more you want to do what? Know. Are we together? So now let's look at the patient education and support. So they provide education and support to elderly patients and their caregivers. Information they will share with them is things like information on medication use, side effect. Maybe, please, if you notice that mama is doing this, please inform us. If you notice that mama is, will sleep and wake up and start acting so, please inform us. All those things that they are telling them about the possible side potential side effect of this drug. It may happen, it may not happen. In case it happen, please let us know. Am I communicating? Or please stop this particular one, continue with this one. This is the information. Is patient education. 2 of us is patient education. So you tell them about the medication use and side effect, as well as the potential interaction. Please do not use this drug alongside this drug. Am I communicating? If mama is taking Cipro, please keep iron containing and whatever supplement. It will not allow this one to work well. Please as you are giving this, wait for some time. Or please, if you are giving, please, this one is for ulcer. Make sure that mama we not eat so number of hours before taking this one. This is our information you give. This is piece of information you give. This is what is called part of what you call patient education. Are we together?
Yes, sir.
Patient education. So at the same time, they also, apart from pharmacological and whatever interaction, they also go to social support. I'm not communicating. Social support. So they also offer social support, and we assure the patients and the caregivers. And this is essential in addressing their concern and improving their overall well-being. Just that word, don't worry. Mama will, once mama take this medicine, bam, mama will be okay. You say, okay, no worry. Mama, don't worry, don't worry. Once you take this thing, you remember how many times I say you should take it. Once you take it, the moment you'll be okay. Mama, you just sleep well. Mama will be happy that you have reassured them that this will do what? So want to hear from you. Are you sure? No. You don't need to worry yourself. Don't worry. Now they will not be striving to do what? Take it the way you do what? Want them to take it. And if they truly take it the way you ask them to take it will take care of it. Yes. Because the doctor clerked well, the medical lab did its own well, and the medicine you are giving is the right one. Why won't you take care of it? It will. And they'll come back and happy, thanking you for what you did. Hello. Let me share a story with you. One of my classmates, he has a pharmacy. He travels sometime a week. Sometimes last week he called me to be coming and be helping out in his pharmacy. I went there. I was just doing my normal thing. So when he came back, I stopped going. One person, they came with prescription. No, not even prescription. They came to buy haloperidol. They came and was like, hey, I was like, madam, calm down. The nurse was even trying to get out. I said, madam, what do you want to use this drug for? He said the doctor prescribed it to her. I said, where did the doctor prescribe it? I want to see that prescription the doctor wrote. He said no, that he told them on phone. I said, who you talk about that on phone? I said, okay. I became interested, and I started asking her. She said that they went to the hospital. They are not patient to the doctor. They went to the hospital, and they have a file for the patient. Now, when they now went home, I asked her a question. Does that your brother, their mother also? Does he behave as if she's not together again? How does he behave? He said he was just talking anyhow. He was just talking as if. I said, okay, fine. But I was like, my issue is, why would the doctor tell them on phone? I asked them, has he been on this drug before? Has he taken it? They said no. I was ask, why would the doctor say on phone to go and buy a drug like this when there's a folder for the patient in the hospital? Who does that? I said no. I said, this doctor you are talking about, where does this stay? She mentioned. I wanted to come with it. I said, please, I wouldn't want you to just get this in like that. Call the doctor back. Before that, I asked her, did the nurse that maybe called her to say no? The doctor called them directly. I said no. The right thing should have been bring this patient to what? Hospital again. You call the patient properly and know where that disorientation is coming from. Then, right, if he must take the haloperidol, it should be in the case file. It should be in the folder for the patient. Where written there, then they will now write out the prescription and give it to go and buy. If they don't have it in the hospital. What you do is this: before you buy anything, please go back to that doctor again, try to find out what happens. So because of the way I was talking, he said no, that they are not buying it again, that they will go back to the doctor. There and there, she called one of her siblings. Immediately she called the other one, told her, please don't buy it, go back. That one concurred with what I said. That was when I saw them last. They left. I stopped going there now. I mind my what business is there. I have done my job. Hello. I have done my consultancy job and put my money in my pockets. Go my way. I don't know that I have been going there since that time looking for me. One day I went to buy bread. Is it bread I want to buy? Or for banana? I can't remember again. Not Prestige. Better Day. That Better Day. I went there. So as I was coming out, one woman came to me. She was so happy, excited. Hey, I'm looking for you. I'm looking for you. I was trying to reconcile. I was trying to. The face wasn't that. She was. It's me now. That people that came to buy one drug in that pharmacies. You told us to go back. Hey, thank you for saving us. I was like, what happened? I remember what happened. He said, do you know that we later went back and carried we later found out that what was her issue was actually the BP was higher than normal. So the thing now entered and started making her to. We didn't take that drug again. Though. We now focused on the treatment and everything. Now it's okay. I say wow. The point I'm making is this. The point I'm making is this. It's not about selling and making money. It's not about selling. I don't have a pharmacy where I sit down, but I know I'm a mobile pharmacy. I don't have a place I sit down and collecting money from people and giving drugs. But that thing, so as far as that woman is concerned, that pharmacy saved, helped them. As far as is concerned, that pharmacy what? Helped them. So the point I'm making is this, and for you to be able to get that level, at least you should equip yourself. Know one or two things you'll be able to help, because this work is all about helping people. Yes, you make money from it, but at least help people. It's not just about let's sell and make money. Let's sell and do what? Make money. I'm talking about like this because some of you may have one, or may want to have one tomorrow, or where you are working already. Yes, they want you to make money, but there are some intervention you will make today that will bring money tomorrow. Money you can never imagine. There's an intervention you make today that will grow confidence in that particular work premises, that will bring the money. You may not be able to quantify that money. Am I communicating? So the point I'm making is that let's do the what? The right thing. Let's do the what? The right thing. Because you know what, you just start, just place somebody on it's not paracetamol you just buy and take paracetamol. No, there are a lot of things you should put into consideration before placing that patient on that. It's not about placing person. The person would somebody have not been taking this for the first time. Find out what the issue is. It's not what you do on phone. That was the only intervention I did. I didn't say they should not take it. I say please go back to the what? Doctor. Let the doctor do the normal class. It's not what he'll be in his house, because you say I think they said the person was, I cannot say exactly what he said. I think the person was asking about his eyeglass. He was about his bicycle eyeglass. Instead of asking for the eyeglass, he was asking them about the what? Her bicycle. So the person was actually going. He was asking of the what? Bicycle. Instead of what? The eye what? Glasses. He was asking of what? The bicycle. So immediately I heard that one and say, even though yes, but it's too early to place him on that bagam just like that. That was what I want to be sure of what they are doing. But at the end, to God be the glory, see what happened. The patient is okay. But what keeps going through my mind that time, even after that I was like, but why? Does it mean that they didn't notice? How would they notice? The person was at home. On the funny point though, the person was at home when they call the doctor. Instead of sending the person back to the hospital for proper what? Clacking to be sure what is happening. There he say buy haloperidol. It's not quack. So sometimes we make mistakes. It's not quack. The person, how can it be quack? Do you know what is quack? A quack is somebody that A quack is somebody that is not a medical doctor and he fought himself as a what? As I am now, I am a what? Pharmacist. The moment I start parading myself as a medical doctor, I am quack. Is that quackery? Am I communicating? Yes, that means quackery. Even though even if you like, be a professor of pharmacology, that knows pharmacology in and out, not to come by. If you like, be a professor of pharmacology. Once you start parading yourself as a medical doctor, it's quackery. Am I communicating? It's quackery. So don't say the person is not quackery. Maybe they were pressing him to do something out of maybe how pedal will help in the cycle. Let me just give. But a lot of things you should put it into consideration before you start giving that. There should be a root cause for that particular someone that has not been diagnosed properly as a psycho patient. There's something must have. You check all those signs, all those vitals, be sure that everything is in order before you now. All right, so let's continue. So it's not quacked anyway. So documentation and record keeping. Documentation and record what? Keeping. All right, pharmacy technician maintain accurate. Very important. How can you maintain accurate? When simple things I posted on the group, you cannot read it. Where is the accuracy? Yeah. It is part of the training, It is part of the what? Training, That one day. Pharmacy technician maintain accurate and up-to-date patient records. Up-to-date patient record, including medication list and allergy information. They also document medication administration, including dosages and times. The time they were given, and they also report any adverse reactions or medication errors to pharmacists. Listen carefully. They report any adverse reactions or medication errors to pharmacists and other healthcare professionals. So sometimes the pharmacist may not be there, or sometimes they may not have a pharmacist. Maybe when the PCA want to come, they will go and front one pharmacist, say they have a pharmacist. When PCA disappears, they continue with their pharmacy technician. It happens in some places. It happens. So that's their role in documentation and record keeping. Now, collaboration with healthcare teams, very important. Collaboration with healthcare teams. So pharmacy technicians work collaboratively with pharmacists, nurses, and other healthcare professionals to ensure comprehensive care for elderly patients. Everything they do to that patient, they do to the elderly care, but they are expected to be more careful when it comes to elderly patient, just as you are also very careful when it comes to pediatric patient. That doesn't mean we should be careless with adults. So they participate in patient care. They participate in patient care planning, including medication management and monitoring, and communicate with caregivers and family members. They communicate with caregivers and family members of the patient to ensure consistent, very important, to ensure consistent and comprehensive care. To ensure consistent and comprehensive care. So what are other rules? We just mentioned them. Things like other rules. They also assist inventory Thank God you are doing your logistic and supply chain management. That's why you are doing it. Anything you are doing here is not for play. There's a reason for anything you are doing. I'm using it now. You assist in inventory management. That's why you do your logistics and supply chain management. So don't play with it. Don't just do it. Let me just pass it and go. Pass it and go. But tomorrow you see yourself, they confine you in the store. You're looking at the store like this. You know where to start from. Because those things you did here, you just cram cram what you don't know and pass. Hello? So they are assisting inventory management, including ordering and stocking what? Medication. Yes, I've been in a lot of places. Their stores are being manned by pharmacy what? Technicians. I've been in a lot of community what? Pharmacies. Their stores are being manned by even some hospitals too. Yes, even some hospitals. Because you go to some hospital, the pharmacist is the head, but other satellite, this thing, the store, he plays pharmacy technician and walk with and through them to achieve his what purpose. Will he kill himself? Only one pharmacist, a big hospital, and this is common in private hospitals. I'm not saying I'm not talking about individual. I'm talking about many missionary hospitals. These are the ones that are even most private hospitals don't even employ. So but they don't even employ pharmacy technicians at all. Some don't employ, but their eyes are opening now. Yes, I've seen some private hospitals employ pharmacy technicians. Yes, at least it's still something than getting somebody that didn't pass through pharmacy education at all. It's better than employing someone that didn't pass through pharmacy education at all. That one is the worst. If you employ pharmacy technician, it's okay. But as pharmacy technician is working, and you start seeing their impact, and as the hospital is growing, you see that same photos. They start thinking of getting a what? At least one what? Pharmacy. But they're not enjoying the what? They're just seeing what they were not seeing before. If pharmacy technician could make this impact, that means if you just get one pharmacist, at least we have money now, we can do it. You see, they start thinking, let's just get one word for pharmacist. Maybe he can work from morning to 12 and go. Gradually, you start seeing how to grow. They start employing pharmacists. Maybe 1 to 5 or 1 to 6 or whatever, depending on the size of the what hospital and the services they do what render. Any question? Okay. So they participate. They also participate in quality improvement initiatives such as medication error reduction and patient safety programs. They also provide support for medication therapy services. They also provide support for what? Medication therapy services. Medication therapy services. Anu, what are you doing? Medication therapy services. Anu. Alright, so in conclusion, pharmacy technicians play a vital role in the care of the aged. They support their medication management, patient education and support. They document in documentation and record keeping. They also collaborate with healthcare teams, and they also have other essential functions. So by doing all these things, pharmacy technician contributes to improving the quality of care and outcomes for the elderly patient. You really don't know who you are. You don't know. That little one, yes, it's not complete pharmacology you are doing. That one you are doing, take it serious, grab it, try to know it at this level, grab it. All these courses you are doing, try to grab it. You will pass. Remove that passing for try to ask the question, why are we doing this course? And start seeing the application of the course you are doing, particular course you are doing, in your practice as a pharmacy technician. And you see yourself doing well. You'll be proud of yourself. And the institution you are working with and for will also be proud of what? Proud of you. And you become a doctor in your own what? Family. If they ask you the one you cannot explain, you know where to get information. You know who to contact. You know who to call. Am I communicating? Then tomorrow, if you want to proceed and continue in pharmacy, continue in university as a pharmacist, what you did here will help you to even do what? Go what? Higher. Give you the confidence to even think of applying. There are people that after playing here and go, they don't have the confidence to even go do what? Apply. Because they ask themselves, me that know how I managed to even graduate here. Am I sure? They started limiting themselves already because to them they cannot do it. They manage to. Is it pharmacies? I will not go and study. Me that manage this one. Even when the parents are saying, I'm not interested. He's not true, he's interested, but he's afraid. Go, we have money. We I'm not interested. No, the confidence is not there. But if you build yourself here, that confidence will be there. And let me even tell you, if you build yourself here very well, maybe you are still working, you are working and you are studying or whatever, if you build yourself well and enter university to study pharmacy, mama mia, you'll be fired. You'll be fired. Yes. But all these jambitos, you guys backing up and down. They don't know what you've seen. Especially they don't know what you passed through. Especially in my hand.
Especially your hand.
They don't know. They will be backing up and down, wasting their time. You'll be more focused. Because what they are seeing, you've seen them before. And now you are in the main business. And most of the things you'll be taught that time, they will teach you that time, you will now be reasoning it with not just about, to them it will be like film, but to you, you are only trying to cement, built on a foundation laid 2 years back. You start seeing it in a more mature, more practical way. And then if you finish and come out, men, the type of pharmacists you will be. Yeah, we are all what? Pharmacists, but we have what? Pharmacists. And even we as pharmacists, we know we have pharmacists and we also have what? Pharmacists, even within us. We know we are not, yes, we are the same thing, we are pharmacists, but we know ourselves. We know who is what? Who. And when we see who is who, we respect. Because we know who is who, even among ourselves. Those outside see us, we are all what? Pharmacists. But among the pharmacists, they know the pharmacists among the what? The pharmacists. And it's all about how you build yourself. Simple.
I want to know the difference between
assistant, even though in assistant pharmacy don't have this formal this degree, what is called OND levels study. No, they don't have it. Assistant pharmacists are just actually even in they don't pass through the formal. Yeah. There are people that are still in the working in the formal, maybe by virtue of the training they receive there, they assist but not really this formal this thing we are doing here. Am I correct? They all of them are categorized under pharmacy assistants. But some of them may know based on what they were taught, but not to the extent. You are here studying pharmacology, but it's not for them.
They don't know the meaning.
But they know that this drug can be used for this drug. If they ask them bring omeprazole, they know where to get it from, and they know that it's for what? Ulcer. And they know some of them that are eager to even learn know that how it is to know the dosage. I'm not complete in the head. But you are doing the one that is proton pump inhibitors, PPI. You may say PPI to somebody, they will like, what is this talking about? You say no. This one is PPI. This one is H2 antagonist. That this one is because you studied it. You say okay. Cimetidine, ranitidine. You say no. This one is what? They are what? H2 antagonist. This one PPI, omeprazole. All those things you know them because you are a former. You did AM, but them they know that all of them are what? Also what? Drugs. Am I completing? Except those that are truly want to develop themselves, they may start. If they are there, they may study and come to you. Please, I'm seeing PPI. You be saying PPI since what does it mean? Some that want to learn, you cannot explain one or two things, but your level of knowledge with related to what drugs is not the same thing with them. Is that clear? So that is where we come. The journey we started since when? I'll come to an end today.
Hallelujah.
So, is now please, I want you to study your exam. The timetable will soon be out. Please study, prepare for your exams. Prepare for what? Your exams. Revision. That one is not an issue now. That one is not an issue. LBJ. Our exam is MCQ. Huh? MCQ, multiple choice questions. MCQ. OBJ, sorry, the one you call OBJ. The official name is MCQ, okay? That official name, MCQ, multiple choice questions. You're clapping. Clap well. It's good. You're happy, Shay? Please, of course, you know my rule. It holds. Please prepare your mind. You're answering 120 questions. Under 1 hour, 60 minutes. 30 seconds per question. Prepare your mind. Hello, it can be CBT depending if the school, what we are doing, if we are ready by that time, it can be CBT. But if all things being equal, it can be CBT. But if there is, it will be what? Circle. But just know that you are answering 120 questions under 1 hour. So prepare your mind towards that. You're laughing. All right, thank you very much. Any question, please ask. Any question? Yes. Test. Which test? Okay, PAC. Yes, yeah. For those that are writing this thing, please go through the information on the WhatsApp group. Go through that and act accordingly. If you keep, I won't talk to you. See, the issue that I have a lot of groups I manage. I have a lot of groups I administer. So, or if you paste it, I'll bring out just a particular period of the day, look through it and select those that would write. So if you go and be doing what you are doing, I'll keep ignoring it because I don't have time for that until 10th. And once after 10th, you will not write. You see your CA like that. Please go through that. Everything there is self-explanatory. There are nothing hidden there. Am I committing? Please, I beg in the name of God. All right, thank you very much. God bless you.